Welcome everyone to the MSP Resources Question and Answer webinar. Now, this webinar is going to be a little bit different in that what we're going to do for resources is we're going to focus on the resources that are answering your questions. This isn't just a general resource webinar that was last week. My name is Tom Ryan and I'll be your presenter and I'll be able to answer the questions. Also with me today is Ashley from my team. Ashley's going to manage that chat feature. She's going to be the one asking the questions out, doing all of that. We are going to only take questions in the chat. I'm not going to open phone lines and kind of go back and forth with that. That seems to get to be a bit much for people. And it also takes a bit more time. So we thought if you could just put them in the chat, we would go through them that way. A little bit housekeeping. If you do not have the presentation and you would like it, please feel free to download it right now. It is in the training center and it is available to you. The training center is on our website. It's in the live events page, but I want to let you know that either later today, by the end of the day, or tomorrow morning, so between that time frame, we're going to remove it from the live events page. Then you are going to have to wait just a few days, maybe up to 2 weeks, and we're going to put it back out on the Encore presentation page. Interestingly enough, I did have someone ask me if I would show them how to locate this information. So let me do that before I go any further. If you're on our website, and our website is WPSGHA.com, what you want to do is actually scroll across the top, just right under the address bar, and go to the training center. It's going to be in the center. Go to the live events page. This is on your left side. On the Encore page, which is in the middle, this is in the body. And these are cards, so you're going to select it, select the card. This is where it's at. Scroll down until you find the one you're looking for. This is our third webinar today. So it is the third webinar listed. Again, this will either remove later today or tomorrow morning. If you want to locate it after that, you're going to go back to the training center. You're going to open the second box in the body, and that's the Encore presentation box. When you open that, you'll see a list of Encore presentations. You do have to open the one you're looking for. So if you happen to be looking for the one where it was the resources, where I actually went through all the resources without the questions, that's what this 528 event is. If you open that, you can download the presentation material here for that one. So if you didn't have an opportunity to attend 528 and you want to watch it, feel free to do that. If you'd rather just get the PowerPoint for it, that's great too. That's just a little bit of information I definitely wanted you to have. And the reason that I wanted you to have that is just to help you through that process. Do want to remind everybody that we are going to take questions throughout and we'll take them in the chat, and the questions will be answered as best we can at this point because I may not have all the details or I may have to ask you for additional details. Last thing, I am going to give you guys a survey at the end. I'm going to give you some different options to take a survey. Really would love your feedback on that survey. It's really important to us to gather that feedback and to see what you think. It's not just about this webinar. You will be asked a question about rating us as a MAC on an overall basis. Let's get some disclaimer stuff done. We did create this material. I did put most of the questions that I could into it, and those were the pre-submitted questions. But what wound up happening was I got a couple of late ones, so I'll address those before I open for live questions again. This material is as accurate as it can be. It does change because Medicare does change. The material may be outdated. You want to check the cms.gov website for the official coverage regulations and rulings. Our website, which I just showed you, is actually a contractor advisory website or advice website, information like that. CMS website always contains the official information. Reminder that you should not be recording this or any webinar that we do have. We do not allow that because we cannot ensure how you're going to use it. What CMS has done is prohibit the recording of any webinar for a profit-making purpose, and because we can't ensure you're not going to use it for a profit, we ask that you don't record, screenshot, anything like that. You're not using an AI assistant that's going to do that or any of those types of things. On the other hand, we will record it for you. Once we record it, we will post that as an Encore, which I already explained. Couple of things. Let's talk about exactly what this one is going to go through. So first of all, my objective is to help you find information to answer your questions. To do that, we're going to talk a little bit about some of the websites, but each website and each resource is tied to a question that you ask. So there's going to be a lot of times where I give you a question, then we talk about where to find it or why it's where it's at. That's what this is. This is a question and answer session. The resource comes in with helping you locate the information on the website to get the resources. Of course, there's always going to be questions where you're like, where's that resource? And it's not specifically spelled out in that manner. A couple of different things will be from the Social Security Act, and I'm not going to give you the actual sections or anything from the Social Security Act because it doesn't state it in that manner. So I will answer the questions for you though. If at that point you still need some additional resources or additional material, you will need to add some more information back into the chat. I want to let you know first, I'm going to answer CMS resource questions, which means questions related to information on the CMS website. Second, I'll answer WPS resource questions, which are questions related to information on our website. And third, it's going to be that live question and answer. So I have no idea what we're going to get there. So let's get going. So first, CMS website. And your slides that are built in here, I will reference them, but a lot of times I will actually use the website itself because I think it's more useful if you can see where I'm going and what I should be doing than just kind of sitting with a slide up and not really showing you. So again, if you want to stay with me, you can always follow the slide deck. It will help you through. All right, so I'm on slide 6 right now. We're going to move to slide 7. On slide 7, it's labeled manual. The first questions that we are answered are in our daily operating instructions. These are the manual instructions. This information is both for you as a provider representative or the provider yourself and for us. So it's the manual references. The reason that this is important is because they're not different from the provider to the contractor. We each have to follow the same manuals. The manuals are actually going to be located in the Medicare area because we're talking about Medicare. Then when we scroll down, you're going to go to regulations and guidance. Again, these are the manuals. As I said, manuals, that one's really hard to find. It's in the blue body, and it's going to be the first link on the left side. Then it's the internet-only manuals, which is right here. Now, inside the manuals, there are a lot of them, so you can read through the different titles. The one that I really wanted to focus on for this particular question is, where is it located that there's a list of excluded services that we don't ever have to look at MSP with? Now, I'm going to assume that by the term excluded services, you are talking about things Medicare does not ever cover because the law does not allow them. They're not part of the Medicare policy. If that's not what you meant by excluded services, please put that back in the chat. I'm not sure. Based on the question, my answer to you is this is actually not in the MSP manual. Okay? There is a whole section called Medicare Secondary Payer MSP Manual. However, this information would be within the Benefit Policy Manual. And when you go into the Benefit Policy Manual, you're going to use the 100-02. You get to read through a lot of manuals. I'm going to scroll down, so if you don't like a fast scroll, by all means, please look away. But I'm going to scroll down, and I'm going to come to Chapter 16, which is your General Exclusions from Coverage. When you open this chapter, it is broken into various sections, and you can read about a lot of different general exclusions from coverage. If it is an excluded service, that means it's never covered by Medicare because the law said no or some other way it's program excluded. That means MSP does not apply. Hopefully this is the list you're looking for, but remember that when you're within the list, you also then have to select different things. So no obligation to pay for services, all those different types of information you might need, lots of just different items within this. And I'm not going to get super in depth within it because I wasn't asked for anything in particular. I was just asked for a list. This is where you're going to find the list. Okay, so there's our first question answered. Another question interesting on the CMS website that I actually want to show you because I think it's important is where can I find contact information to update the records? So this is going to actually be in the CMS website in the coordination of benefits area. So we're going to go back to Medicare because that's what we're talking about. We're going to look down this section here until we come to coordination of benefits and recovery. Not Medicare, Medicaid coordination, but coordination of benefits and recovery. When we select that, this has a lot of information for you. I'm going to recommend that instead of going to the provider services or the beneficiary, just come straight to the overview for the contact information, straight to the overview. If you scroll down, and I'm just going to follow down on the left side again over here, here's your contacts link. Here's where you find all the information you need to know. Okay. Benefit Coordination and Recovery Center is the contractor that updates this record. It is not updated by us. So I wanted to make sure you're well aware of that. Hopefully that does help you. Okay, the next question is actually back in the manuals. So I apologize for not answering this one first, but let me go back to the manuals for a second. So Medicare, regulations and guidance, manuals, IOMs, scroll down. What we're looking for is billing a claim instructions for MSP. They're the same claim form instructions as any other type of claim. It just tells you which fields need to be completed. So that is in the Medicare Claims Processing Manual, not the Medicare Secondary Payer Manual, but the Claims Processing Manual. Inside the Claims Processing Manual, and again, look away if you don't like the fast scroll, we're going to scroll down to towards the bottom, and you're going to have Chapter 25, Chapter 26, and I'm sorry, Chapter 24 is EDI or electronic filing. Chapter 25 is UB04 filing, and Chapter 26 is the CMS 1500 filing instructions. And you want to make sure that you follow these instructions. I'm not sure which one you were looking for on that particular set of claims. I also want to stop here for just a moment and jump out to our YouTube channel, because we have done classes that will walk you through how to file a claim. Okay, walk you through how to file a claim. So if we go from this channel and we want to find just specific information, I'm going to recommend playlists. Yes, you can search all of our videos, but the playlist will bring you to a Medicare Secondary Payer playlist. Oops, except you got to spell it right. Otherwise, it's not going to bring you anywhere. And inside the Medicare Secondary Payer playlist, there are courses. I didn't mean to open the webinar. I wanted the playlist. Sorry, let me go back for a second here. You're going to scroll down until you find the playlist for this. Encore presentations. Let's try. Okay, so here is the Medicare Secondary Payer playlist. We click it. And it keeps opening the same thing, but you can see here's the playlist located here. So it's just going to automatically open that one. You do have to look through your playlist. What you're looking for is the billing courses, which are right here. And you can see Medicare Secondary Payer billing the multi-carrier system. That's a 1500 or a 37P. Or Medicare Secondary Payer list billing the FIS system, which is a UB04 or an A37I. So I don't know which one of those you need, but that's where the actual instruction, like I'll put together for you in a nice, neat training is at. So, all right, let's go back to the manuals because we have one more manual reference that someone did ask me about. What you are asking about is the Medicare Questionnaire. I think that part of the reason with people finding the Medicare Questionnaire is that it's actually labeled questions. It's not labeled a questionnaire. But let me show you where to find that. Now, this is going to be in the Medicare Secondary Payer Manual. These are questions that you can use to determine whether or not someone has primary insurance to Medicare. We're going to come down to this billing requirements section right here, which is Chapter 3, MSP, Provider, Physician, and Other Supplier Billing Requirements. Now, you can wait for it to open, sorry. And then when you get inside, you can read through a variety of different things. What you're actually looking for is Section 20.2.1. Remember, I said it's called questions. So it's the model admission questions. This is what you're looking for. When you open it up, it does walk you through the recommended questions from CMS. Let me remind you, I said recommended, not mandated questions, recommended questions. The difference is you're mandated to gather the information. CMS says you have to do this. On the other hand, they don't say you have to ask these questions. They've given these as a sample or something you could use. So that's where these model questionnaires come from. But they do start off, working with, hey, is it about Black lung, workers' comp, no fault liability? You answer a series of questions. Is it about entitlement for group and group health plans? And so you'll answer a series of questions. Each question, when answered yes or no, may give additional questions and things like that. So there's a variety of different pieces of information you can see within it. Again, I'm not sure what else you were looking for on the questionnaire, so put that back in chat so I can help you more if you have more questions or if you're just simply looking for where that information is located. Okay. All right, let's jump back for a second then, and let's go back to the CMS website so we can actually, get out of the PDF document. Our next question is, where do I locate basic MSP training? Your basic training will always be on the CMS website as well. And so you're going to go back to Medicare. What I want you to do this time is come back down to that coordination of benefits and recovery area. Go ahead and open this up. Again, we're just going to go to the overview. On the left side, you'll see a link called Medicare Secondary Payer. That's what we're talking about here. So let's open that page up. As we scroll through this page, and we have to get to the very bottom of it, it has a lot of great information. It's going to give you all the general information. But the training that CMS offers and that we use for this type of information when you want an on-demand style training is at the bottom, and it's an on-demand course, and you can simply move through each module, which will be explained what they're looking for. This is your basic training. We do offer courses on this that go through this information. Our hope is that if you take this and then you listen to our course, what you'll be able to do is put together the questions that you have so we can help you. Because if we can't help you, then we're going to get you into billing issues and take back issues and a whole bunch of other things, and we don't want that situation. So this is where you're going to start with your basics. If you're interested, keep watching our information on our website. We are getting ready to start over the MSP series, which again, will start with a basic course, then work through the different types all the way through it. It's usually about 12 sessions and does take an entire year because we only have one a month just to kind of keep everything moving along there for you. All right. So that is the resource, and to answer that question, this is where you're going to find this information. Again, if we go back, don't forget about these different links right here. Provider services is great. It's going to explain to you what you need to know, all of that, gathering information, etc. All right. Let's scroll back up because the next one asked about the Medicare Learning Network. And in particular, they were asking about one of the two articles. So I'm going to go ahead and open it up, bring the two articles up, and then I'll explain each one, and hopefully that will answer your question. So the Medicare Learning Network is the CMS education portion. What they do is put different training materials and different educational materials out. So we're going to go to training and education because that's where the Medicare Learning Network is. Then we're going to go to Medicare Learning Network on the navigation bar on the left side. And then we're going to go to resources and training. Now, it's interesting that they have a resources and training, including a web-based training, but the MSP course is not listed on this web-based training. So people get confused by that and they're looking for it. They're like, it's just not here, right? Understand that. That's why I showed you where it was the other way before we came here. So if we jump back, we can go to publications and multimedia. And then you can see, here's one called Medicare Secondary Payer, Don't Deny Services. I'm going to use the word secondary. And the reason that I'm doing that is it's going to bring up the two sets of information. Now, I wasn't really sure which booklet you were talking about because the MSP General booklet is a booklet and it's got a lot of great information. The other one just is a reminder that you shouldn't deny services based on MSP. I do want to take a second to show you the booklet, and the reason that I want to show you the booklet is because there's a chart in here that I think will answer a couple of the different questions, okay? So let's go ahead and jump to Medicare Secondary Payer, and we're going to open the booklet up. This page is just a loading page for CMS. What they do is anytime there's changes made to the booklet, they add it to this page. The reason that they do this versus just opening the PDF is that it would create a broken link. So if you have this page bookmarked, that's great. don't bookmark the downloads, which is this page, and it's going to be a PDF. Bookmark the page before it, that way you're always going to get the most current version. Here's the question that I think you should be looking for. And the question is when to determine and how to determine who pays first. Okay, the quick reference or the full instructions is in the Medicare Secondary Payer Manual. It's got a lot of information based on the Social Security Act and all of that. The quick reference, what I think is what you're looking for, I hope is what you're looking for, is actually in this booklet. And it's labeled in this section. So it starts on page 4 and moves through a couple of pages, but you can see it describes different situations, tells you about the patient, tells you about who pays first each time, and you just have to read through and find the situation that fits with what you're looking for. Now, I wasn't given a particular situation, so I'm not really sure what you were looking for in terms of which situation you wanted. So if you want me to give you something from a particular situation, I can definitely do that. But I did want to show you the booklet in hopes that maybe you could find that and utilize this yourself. All right, that is what I have to answer the questions that we got on the CMS website. So our next website actually is going to be the WPS website. Jump back up to WPS. Start at the beginning here. Within the website, the very first question we got is, how do I verify MSP information? We will always recommend our website. There's a couple of different resources on our website that will help you through it. First, the login or secure section is the first one. That's right here, and I'm circling it. It's right on the top. It's going to be on every page until you actually log in. This is the section that we're looking at. All right, things you need to know. I can't log in. Why can't I log in? Well, it has protected health information and personally identifiable information. I have no way of filtering that out when I'm showing it live. So I'm going to use the portal user manual because it's the next best thing. Okay, so this is where we're going to be on slide 11, and it talks about the Secure Net Access Portal. You'll hear me call it the portal. Sometimes I'll call it SNAP. They mean the same thing. Okay, so Secure Net Access Portal. If you scroll down and you're looking for identifying primary payer information, you need to look under the term eligibility. And that is the patient eligibility check. So eligibility check. Once you open the eligibility check, it's going to talk you through step-by-step instructions all the way down to what you need to pick for each one to get through it. One of the questions we received about the portal particularly is on this page, and they said, what is this supplemental insurance? It is supplemental to Medicare, the Medicare payers that come after us, not Medicare. So things like Medicaid or plans that are specifically purchased to be supplemental to Medicare. Medigap would be another example. You want to stick in the eligibility section because in the eligibility section, you're going to look through the different options that you have. And of course, this one shows MSP as a gray out, which just means this person doesn't have any MSP information, but that would be an option. Now, again, I'm going to recommend a look away. If you don't want to see a fast scroll, I'll talk to you in just a couple of moments as I get down to that MSP information. Okay, so I'm at the MSP information. And again, I just scrolled down the page. You don't have to scroll as fast as I did. Once you select it, and it won't be grayed out, it will be blue, like the Part A deductible, Part B summary, all the top ones. It's going to be blue with a white, not gray on white. And it will explain what we have available to you. What's great about this is it will give you multiple records if we have them. So this is probably one of the best sources to come to get this information. Best sources to come. This will then give you all the information you need if it's on file. So if the Benefit Coordination Recovery Center has it on file, then we'll transfer it to you. Hopefully that makes sense. This is done via the 270, 271 HIPAA standard transaction. It's an eligibility transaction. It is instantaneous. Unless something isn't updated to start with, then it's not instantaneous because then it may show old information. So if information isn't updated, you're going to get what we have too. And if it's not updated, we can't process claims. It's the same check that we use to verify that everything is updated. Okay. Also, along with that, you can use direct data entry. DDE. You could type out direct data entry, all of that's great. I always like to tell people start with the overview so you learn what this is. I want to point out right here that direct data entry is for Part A line of business. A Part A line of business means a claim billed on a UB04 or 837I, and it can be J5 and J8, both of those. Direct data entry was a feature that was built into the Physical Intermediary Standard System, or FIS. It was not built into the multi-carrier system, which is the system that processes the CMS 1500 claim forms and 837Ps. So not available. It will actually, if you pick the Part B line of business, which is the 1500s, it'll actually give you a little box and say, nope, can't look at it. Not going to help you. Everyone saw that. This is just the basic starting information. It's how to request access and all of that. Direct data entry is something that's done with a vendor. So you do have to contact a vendor and establish a vendor and get all of that information. But on the bottom of this page, there is a manual, and you can check out that manual. What you're looking for is the HIQA screens, and it will walk you through that information for Medicare Secondary Payer. So those are a couple of different options that I have for you if you want to check out what we currently have in our system and you want to see what's going on. Okay. Another interesting piece of question is the specialty and training page. Now this is on our website versus the CMS website. The question that you got, or that we got, is there a consolidated list? Is there something that just gives me a bunch of different resources so I'm not going to have to go hunt them out? That's where the specialty and services training page is. I did summarize that question. They actually had about 6 different things they were looking for, and they're all located here. So if we go to the training center and we scroll down, the last item on the right column is specialty and services, training and resources. By opening that, you'll be given a list. Medicare Secondary Payer resources is one. And on that, it is a list of resources. Where do I go to find out what I need? How do I get the information that I want? In particular, the question you actually asked about would be within the, sorry, I have to find the right one here. The manual system that we talked about was one set of questions. Also, if you're looking at it, patient eligibility website would be another one. Okay, so there's a variety of different places to go with this. We do have an article called MSP Questionnaire. We use the word questionnaire because CMS uses the word question, and we want you to be able to find it easily if you're talking about questionnaire, because for a lot of years, that's what it was referred to. So that's what this article is about, but it does simply refer you right back to where I was at in the first place. 20.2.1, which is what we actually talked about, okay? I'm gonna go back to that specialty training page. A couple people asked me about some different Part B A and B billing tips. Again, you can look at and see what we have out here on our website and different pieces of information. Here's the YouTube playlist. So I showed you the long way to get to it. No need to do that. You can simply come to this webpage, select it. It's going to open the playlist for you, and it opens it in a much nicer way than before. And then you just scroll through and find whatever you're looking for. Here's Part B, here's Part A. So Part B 1500, Part A UB04, again, electronic equivalent included with both of those. So this is one that was interesting. I did get quite a few questions on conditional payment. I will talk more about conditional payment, but I thought since I was here, I might as well point this out to you too. Conditional payments. So we'll get more into that in just a few moments. All right. So those are some different items you might want to be aware of. I was asked who updates the Benefit Coordination and Recovery Center. And again, that is the who updates the benefit records, the coordination records. That is the Benefit Coordination and Recovery Center. Here's the article for that one on our website, which will simply explain to you, but then link you out to the CMS website as well. It just depends on what you're looking for there. Again, here's that contact information. If you happen to be on our website, you don't have to leave our website. We gave it to you so you can easily find it, okay? Let's see, we talked about the Part A and B billing courses, so you can get those if you need them. That's what we were looking for with billing help. That's all I got, literally, was the words billing help, question mark, question mark, question mark. So That's what I have to offer you. I've given you a couple of those, but let me show you just a couple of things that you might want to be aware of on our website. Part A billing help is available on our website as well. However, it's going to be in the claims section. So we're in, again, the Part A side, which is the UB 04837Is. And if you go to claims, because we don't have a Medicare Secondary Payer area, it's how to file a claim with it, then you can guess your way through. No, I'm just kidding. What we do actually have for you is if you type the word secondary in the filter. Now, please note I am specifically avoiding the word Medicare because you can imagine how many hits you're going to get and how much resources you're going to have. Use the word secondary. It's a better resource here. Here's the questionnaire information, but here is the Medicare secondary billing procedures for Part A, and it'll walk you through all of the different pieces of information you need to know. Now, again, we do have that encore presentation. It does walk you through this information and like where it goes in the claim, all of those different things. I'm not sure what you want from that, but I think this is great information for you. All right, I will let you know that the Part B side does look a little bit different. So we're going to go back to the Claims Center. We're going to leave the Part A side and we're going to do the same thing. How do I find the Part B billing information? And in this case, again, we're going to use the term secondary just because it'll bring us less. If we open it up, here is the same questionnaire article, but the fact sheet is what you're looking for this one. And it walks you through some different pieces of things you have to be aware of, how to electronically file, additional information you might want to know. So hopefully that gives you what you need. Again, remembering the 2 courses that we actually have out there, those are encore courses plus these 2 billing articles. Next question, why doesn't the MSP calculator work? I'm not sure exactly who's trying to build this one or what you're asking me, but let me just show you the MSP calculator and I'll talk a little bit about it. Maybe I'll answer your question. Under tools, on the WPS page, we do have a Medicare Secondary Payer calculator, okay? Look at the third column, first column on the right, whatever you want to say there. And you're going to go to the third item in the row, MSP calculator. First, hover over it. Bring up this pop-up box because this is the #1 thing you have to be aware of. This calculator does not work for all types of insurance. It does work for employer-based plan, which means Medicare eligible people who have employer-based insurance who are working age, end-stage renal disease, and disabled. It's not one of those. So if it's a no fault or a liability, there are other factors that come into play. So we don't want you to use it for that. Second thing to keep in mind, it doesn't work for anything inpatient at all. The reason being, the Medicare allowed amount and the calculators that go with that, those allowed amounts can be very different. For those of you that know anything about a prospective payment system, it's a trickier allowed amount and it does take into account some other factors. So sometimes it's going to give you the wrong information. We just don't recommend doing it with that. So with that said, please look for outpatient services here and make sure it's one of the insurance types that we mentioned out there. Then you're just going to complete it, and with that, it will work. So I think what was happening is you're probably using it for something it's not intended for, and that's why it doesn't work. It straight out doesn't work. So I wanted everyone to be aware of that. The next one I've actually shown you a couple of different times. We have slide 19 for y'all. It's called training videos. And on training videos, it's just where you find these different encores, these things that we've done in the past, and they're on the YouTube channel, which is our YouTube channel, okay? Our YouTube channel. Please make sure that you get that training video. You can watch whichever one you want. Again, it really is about coming to YouTube, finding the playlist, and then just picking the one that you want to take. We do load these on here, so it's just a variety of different areas to go to. Here's that MSP resources, which I just talked about a little bit about, but you can see we've had some different ones over the past year, even going back a couple of years there. Okay, so let's jump ahead here. go back to our slide deck for a second. And again, I'm just going to go through the slides that we've already done because we've done quite a bit of different information. Now that's where the resource section comes in. It's really about the questions that you ask. So if there's a resource I can think of while you're out there asking me questions, I will go ahead and answer it with that. I do want to start with a few pre-submitted questions in the question and answer section before we open it up to anything that you have in the chat. The first question we got is, when is the VA primary to Medicare? Now the VA, I'm assuming here you mean the Veterans Administration, and the VA is never primary to Medicare. The way that it works is in the act it says, now the act being the Social Security Act, 2 federal benefit programs cannot pay for the same service. Okay, that makes sense. The VA is a federal benefit program. Medicare is considered the same, even though it's an insurance and even though the VA has a form of insurance. So if you bill to the VA and they deny it for any reason, because when the VA pays, they pay it 100%. Then you bill to Medicare saying the VA didn't pay it. This is not a secondary bill. What you're actually getting Medicare to do is to process it as a primary insurance because the VA did not pay, even though you're indicating to us that the VA didn't pay. There was another additional part to that question, and it was what happens if the patient doesn't want us to bill the VA? Then don't bill the VA. Bill Medicare if that's what they want you to do. Each patient has the right as to which insurance they get to bill. The VA is a different form of insurance. It is a federal insurance program as well, but you don't have to bill them unless the patient asks you to. Again, you could bill them, right? You could try to get that paid, but some of you are not contracted with them. You may not have a prior authorization. Variety of different things happening there. Next question. How do we request a timely filing exception when the primary doesn't pay timely? I'm going to show you a resource on this one, but I'm going to tell you it doesn't specifically say Medicare secondary payer claims are not. And the reason is because it's not recognizing Medicare secondary payer claims when the primary didn't pay timely. What it's saying is you still need to file timely to Medicare. That gives you 1 year from the date of service or 1 year from the date of discharge for an inpatient claim, 1 year from the date of service or date of discharge. You file it and you let us deny it. Then you send in the information and we can reopen it or look at it later, but we have to have it on file for the denial. Right? With that said, in the Medicare Claims Processing Manual in Chapter 1, Section 70 is the exceptions list. Let me just take a second and show you that so that you understand or you see where I'm coming from with this one. So again, oops, sorry. That's a couple questions yet. We're going to go back to CMS website, and we're going to go back to those manuals first. So Medicare, regulations and guidance, manuals. Inside the manuals, go to the internet-only manuals. Once you're inside the internet-only manuals, this question is, the timely filing exceptions are listed in the Medicare Claims Processing Manual. You can see me just scrolling down. That's 100-04. Let's go ahead and open that up. And it's just the general billing requirements, it's general information. So we open up the general billing requirements. And what we're looking for inside there is to scroll through, look at your sections and find the section that helps me. Well, in this case, I happen to know it's section 70. I know that because I get asked that question a lot regarding MSP, but also regarding timely filing. So this is where it lays out timely filing. If you read through section 70 and coming on down here, right, you're going to find the exceptions in 70.7, and it lists them: administrative error, retroactive Medicare eligibility involving state Medicaid, retroactive disenrollment from an MA plan or a program for all and care inclusive for the elderly. It doesn't say anything about primary insurance here. There's no exception for that process. So I want to make sure you're aware of it. I want you to see where the exceptions are listed and how to find them, and know that Medicare secondary payer is not an exception. Okay. Next question is going to be on slide 24 for you, and it talks about conditional billing. The reason I'm going to stay here is we're going to go back out. What we're going to do is just go back to the Medicare Secondary Payer Manual under -05. Inside that manual, what you're looking for is Chapter 1, because it's general MSP, conditional billing applies or doesn't apply. Once you open up this You're looking for conditional Medicare benefit payments right here, 20.7. And then you can read through all this information. I'm not going to read through the full set of information. Instead, I'm going to ask the question and then we're going to talk about the answer. But this is where the answer came from. The question is, what is the 120 days? Well, I'm going to assume you're referring to what is the promptly paid period, which is 120 days from the date in which you filed the claim that the initial insurance did not pay. It's a promptly paid period. Once it's outside that 120 days, then you can file for what's called a conditional payment, which says, hey, Medicare, later after everything is resolved, look at the payment and decide whether or not you're taking it back. In most cases, it actually comes back from the primary payer. It doesn't come back from the provider. So conditional payments will help you have revenue during the time frame. Sometimes it's just really important to get that revenue. You have a lot waiting. So that's what a conditional payment is. Again, it's an interim payment while the primary decides what they're going to do. It does not apply to all types of insurance. So, okay, it explains right here how workers' comp and no-fault 120-day works. So just additional pieces of information you might want to be aware of. I do recommend taking a chance and reading through this. There's a lot of information on conditional payments. There's so much information on conditional payments that we teach a full class on it. So if you're looking for that class, again, come back to the MSP playlist, scroll down to conditional payments. It's there, it's all there for you. So that class is all going to be based in this manual area. So hopefully I got that question answered. Again, it's actually a no answer because the conditional payment doesn't apply for certain circumstances. The 120 days is simply a promptly paid period or a waiting period after you file a claim, but there are some ways in which it's actually explained up there, and they'll tell you the exceptions and the information you'll need to know on that. What happens, and this is our next question, is going to be on slide 25. What happens when an attorney wants a provider to bill before settlement has been reached? So this is normally going to be billed in what's called a conditional payment, which we just talked about. Remember, I said it's the provider's option, or hopefully I said that. It's the provider's option to bill for a conditional payment. Medicare does not have an option that says you have to bill before this is reached. You have to take a conditional payment before the settlement is reached. That's not what Medicare says. The conditional payment sometimes makes it easier for the attorney to work with Medicare so that there's one return payment for the money, which is why they may want you to do it. But really, a conditional payment is something the provider does not have to do. A lot of providers do it though, and the reason that they actually do that conditional payment is because they get revenue in the meantime. What you can do also when you have to talk about attorney requesting stuff, come back out to the Medicare page, go to the coordination of benefits area. And then if you read through, one of the options is attorney services. This will explain to them all the information they need to know, who to contact, what they're doing, proof that they represent, how they get to work with the BCRC to get all of that information back. Just a lot of information, okay? So attorney services, an attorney working with an attorney that's requesting it, you don't have to do that. You do not have to request a payment. It is a conditional payment should you choose to do that. All right, well, that brings us to the end of the pre-submitted questions with the, with the exception of one pre-submitted question, which came in after I built my slides. So let me show you that. The question was, is there something that will help a patient understand primary payer situations? My answer to you is there's a couple of resources, but please remember 1-800-Medicare is your best friend. Refer the patient to 1-800-Medicare if they're not getting it. You can try to help them through it. There's no reason you can't do that. You can give them these two resources, but ultimately it's 1-800-Medicare. Let them talk to someone. Couple of things that may help. One, start with your basics information. Come right here and go to the Medicare NU Handbook. Now, the website that I'm on is medicare.gov. This is not cms.gov. Medicare.gov is the patient side. CMS.gov is the contractor and provider side. So Medicare.gov. The reason that I always recommend the Medicare NU Handbook This is the annual information that is sent to a patient that they are required to know. Medicare and you. If you want to download a copy, feel free to do so. You're right here. You can get copies sent to you. You can also say, hey, patient can also say, hey, I only want one copy sent to my household. That's what getting too many copies is. So, but let's just go ahead and do the quickest way. And I think this is the quickest way. Download it. When you download it, you can look through a variety of pieces of information. One of the hardest things for me personally is, what do they refer to something as when it's for the patient? Because they might use a different term than you're familiar with. But getting help on your coverage, getting started with Medicare, so you want to look through any of that. Always feel free to use the edit find feature, which is Control and F on your keyboard. You can type second. Okay, the insurance that pays secondary payer only pays if there are, and you can find different references within this book for that type of information. Okay, so there's a variety of different things you might need to know. Again, here second's coming up, but it's coming up in surgical opinions, a couple of instances there. This explains that TRICARE will always pay second to Medicare if they're interested in that. So this is just a really nice starting point. It is definitely not going to give them all of the information they need. It's not going to do it. Here's what I recommend. Go back. Remember where we were up on there, that basics, and there was forms, publications, and mailings. Utilize this one and go to their publication section. So utilize the forms, publication, and mailings. You're going to go to publication. Now comes the best part. You got to figure out what all the different publications are called. And you can read through a variety of different ones. You can select a category. So I'm going to go to coverage and payment. Okay, we've got Medicare coverage of cancer, how Medicare works with other insurance. So here they changed the name. They've called it other insurance, which is why I do coverage and payment versus trying to remember what it's called. But again, you can open this PDF. This is something that is written for a patient, and it'll explain all about the things they need to know. And there's a lot in here, so I don't want to read through it with you, but you can imagine how much is in this just for the patient. You can see it's written in very plain language. Basically, it's really trying to help. It is 27 pages long, 27 pages. So I think this is an opportunity where you could, again, give them that help, maybe help them understand in what CMS terms language written for them. So hopefully that does help you, give you a couple of resources. Again, though, go to medicare.gov for that one. Along with that, someone asked, what's the phone number for 1-800-Medicare? Easiest way to find it is type 1-800-Medicare in any search engine. Hit enter. It brings it up for you. I don't know what they were asking that one in particular for, if it was like they were having an issue finding it or it wasn't coming up correctly, but it's 1-800-633-4227. Yes, I know Medicare is too long, so there's an extra character at the end, but you wouldn't dial for the E again. So hopefully that helps everyone. Should you call 1-800-Medicare? The answer is no, not unless the patient is with you. This is for the patient. If you're looking for additional assistance as a provider or their representative, you need to contact the Medicare administrative contractor who's going to process that claim. In this case, it's probably going to be us, which is WPS, that is jurisdiction 5, Iowa, Kansas, Missouri, Nebraska, and our national collective providers, and jurisdiction 8, Indiana and Michigan. So, all right, so I gave you guys a lot of resources. I answered a lot of questions based on the resources and kind of all work them together. So we're at that point where we're in an open question and answer session. So I want to ask Ashley, do we have any questions? Okay, no questions. Well, that makes it easy on me. If you think of something, feel free to put it in the chat. We will get back to you in just a few moments. I'm going to go ahead and close out then. First thing, what's going to happen just after this is you're going to get a certificate of achievement in an email. Now, I want to explain this. The system automatically generates this email. So if you called in and you did not provide a email address when you came into this class, you will not be able to get this email. Again, it's a system generated one. It's got to have that email address right away. If you did, then you're going to get an email. There's a couple of things to notice within the email. First is the Your Opinion Matters section. This means tell us how we're doing. Give us your feedback. Survey. We'll talk more about that in just a couple of slides. Also, under the bottom, you'll see Certificate of Achievement. We do not issue continuing education units. We rely on the governing bodies to do so. What they ask of us is that we issue you contact hours. They will determine whether they accept those contact hours, and in most cases they do. For instance, the AAPC says, go ahead and say no certificate as an option, and then list the contact hours. They do take them and they translate those directly. I'm sorry, no index number as an option. And then they take it and base it on the contact hours based on the fact that it has to have our information on it, and your email will have at the top our logo, which indicates it's ours, WPS, who sent it to you. Okay, so that's what you're going to get in an email. Next, you're going to get the opportunity to send follow-up questions for 7 days. It's anything related to Medicare Secondary Payer. We just want to gather your questions. This is also the opportunity for those of you who dialed in, and I do know that I had a couple of them on. If you dialed in via the phone and you still need a certificate, you do have to email us. You do need to put MSP Q&A in the subject line. That's today's topic, MSP Q&A. What you need to do in the body is just say, hey, I need a certificate. Here's my phone number. It needs to contain an area code plus the remaining digits. Without that 10-digit number, I can't verify that you were on and I can't issue you a certificate. So I'm going to email you back asking for it anyway. You might as well just do it up front. With that said, though, you are welcome to send MSP questions to us, with the exception of claims related questions. If you have a control number, if you have something like that, they do have to go to customer service. We can't look those up for you. Survey. Tell us what you think. Please do this survey. The survey is available for you right now in the chat feature, and you're welcome to take that survey. I'll also give you the opportunity again via the follow-up email. As you leave this webinar today, you'll be given an opportunity, and that's going to be on the external link. So that's going to look like the bottom picture on my slide. You can select that. It'll open up the survey. It'll take you right there. It's not spam. It's not malicious. It's nothing like that. It's just us asking you to take the survey. Also, if you are listening via Encore, you want to listen again and you want to give us different feedback, maybe the Encore prompted something within you, something you thought about, feel free to do so. But you're going to use the online survey picture, which is the top picture on this slide. And it just allows you to select the picture, open a link on the bottom, and you'll be able to go to the survey. So we do want to hear what you have to say. We wanted to let you know on this slide, and this is not in your slide deck, it's just something we put in, that we do listen. A lot of people ask, well, what do we do with that feedback? The first thing you need to know is that we've done 2 major changes. 1, we did add chapters in our YouTube channel, and 2, we did add training indicators. So both of those were related to the survey. Also, we are currently working on our webpage and the training center and how we can make that better. Your feedback has been invaluable with that. So if you have anything like that, that's what the survey is for. But don't forget to include your comments on what type of training we should do as well. All right, that brings me to the end. Thanks for listening. Thanks for your time. I hope you got some questions answered, some valuable resources, and we helped you through what you needed. On behalf of myself and Ashley, we'd like to thank you for attending. On behalf of WPS as an overall, remember to take that survey, provide us that feedback. With that, you can now disconnect. I hope you have a great day.